Hi everyone, my name is Caitlin Bortmus and I am going to go over my CROUP case study with you for FNP2 Nursing 7046 with Dr. Hoyson and Mrs. Wright. What is CROUP? CROUP is a common respiratory illness that is seen in children that causes swelling in the upper airway, specifically around the larynx and the trachea. This swelling can make it hard to breathe and gives a very recognizable symptom. CROUP is caused by the parainfluenza virus, and it happens in kids ages 6 months to 3 years, but older kids can develop this as well. Signs and symptoms are a barking cough, hoarseness, stridor, runny nose and fever, and the symptoms do worsen at nighttime. So for my patient, the chief complaint is the patient was brought to the clinic today for a noisy cough that sounds barky and worsens at nighttime. History of presenting illness. I have a 2-year-old male with a history of a runny nose and a low-grade fever for 2 days. Developed a barking cough overnight and woke up with stridor. Symptoms are worse at nighttime with no choking, drooling, or difficulty swallowing. Parents state he had a decreased appetite but is taking fluids. This virus typically starts viral, then progressed into a classic barking cough and stridor overnight. The lack of drooling or choking helps me to rule out anything more serious like epiglottitis or a foreign body. For medications and allergies, the patient has no known allergies, and he is just taking acetaminophen PRN for any fevers that he might have. For past medical history, social history, and family history, we have that this patient was a full-term vaginal delivery, no history of chronic illness. Social daycare is 5 days a week, 1 viral exposure, and it was treatable at home. No smoke, no recent travel, and no known sick contact. No previous hospitalizations or surgeries, and he is up to date on all of his vaccines. For family, there is no asthma or airway disorders, no congenital airway issues or immunodeficiency. So CROUP is most common in children 6 months to 3 years, and it is often linked to viral exposures. So when I'm looking at this patient for his history, there's nothing really concerning medically to me. He's otherwise healthy and up to date on everything. The biggest thing that would stand out to me is that he does go to daycare, which, like we just spoke about, it does increase his exposure to viral infections. His age also puts him right at that peak range for CROUP, and there's no family history of asthma or airway issues, which helps rule out some chronic causes as well. For my review of systems, he generally does have a fever and he is a little bit irritable. For his head, ears, eyes, nose, and throat, I do hear some rhinorrhea and hoarseness. He does have that barky cough, that stridor, which definitely is getting worse. No cyanosis. He does have a decreased appetite, but no vomiting, and he is alert. These findings of barking cough, stridor, fever, and rhinorrhea support upper airway viral illness rather than a more serious condition. So as you can see on my physical assessment, the patient does have a fever of 100.8, which is a low-grade fever. He is mildly tachycardic at 120, respirations of 28, and then an O2 sat of 96 on room air. Overall, on his physical assessment, everything does check out other than the fact that he is, a little bit irritable. He is alert but mildly irritable and sitting upright, which is common with kids trying to optimize their airway. Vitals show a low-grade fever and mild tachycardia, likely from distress. The most important finding is the inspiratory stridor at rest with mild retractions, which does place him in the moderate CROUP category. Lung sounds are otherwise clear, which help rules out any lower airway issues like asthma or pneumonia. For my differential diagnoses, I came up with croup as my number one, just due to the barking cough, the stridor, and the viral illness that he has. Two would be epiglottitis. We want to make sure that we are ruling that out. That is an emergent finding in little kids, but he would be presenting with drooling in a tripod position as well, which thankfully he is not. Foreign body aspiration. We all know kids like to put everything and anything into their mouth. So that would be a very sudden onset and a choking history, which I am not noting on this patient. And then bacterial tracheitis. He would have a very high fever and a very toxic appearance to him. Primary diagnosis and testing. So I am diagnosing him with moderate croup just due to, again, the stridor at rest, the barking cough, the retractions, but he does have stable oxygen, which is wonderful. A diagnosis for croup is clinical and based on your assessments and findings. This is one of the things where you really don't have to go get multiple CTs and X-rays and ultrasounds or anything like that to diagnose it. You do it off of your assessment on the patient. If I absolutely felt like I needed to, I could get a neck X-ray and look for the steeple sign on the patient. You would only use that if you truly weren't sure what the diagnosis would be. So for the treatment plan, treatment for croup is pretty straightforward, but it is very important. All patients get dexamethasone because it helps reduce airway swelling and improve symptoms fairly quickly. Since this patient has had stridor at rest, he falls into the moderate category, so we would also give him a nebulized epinephrine for rapid relief. The key is to remembering that epinephrine does wear off in a couple hours, so you would need to keep the patient and observe him for any rebound issues. Supportive care is also very important. We want to keep the patient as calm as you can and keep him upright. I'm sure everyone who does have kids knows that when you have a crying kid, it is very hard to calm them down, and then, it is a little bit harder for them to breathe. Because this is a viral infection, we do not use antibiotics for this. So for the dexamethasone, you would do 0.6 milligrams per kilogram PO once. Like I said, this helps with the airway inflammation and edema. Symptoms will usually improve within 2 to 3 hours, and then you will do nebulized epinephrine for the stridor at rest. This helps reduce airway swelling quickly. This effect can last for 2 hours, but may cause rebound symptoms, so you want to keep them and just monitor them. Steroids are recommended for all patients, whereas epinephrine is used for moderate to severe. And for non-pharmacological, you want to do a calm environment, upright position, hydration. You want to thin any of that mucus that might be in there also. And if a child is having an attack, you can place them in cold air. So I specifically chose CROUP because I remember when I was a first-time mom with my first son and he developed CROUP. And even as a nurse of like 7 years at that point, I was petrified. I didn't know what to do. Mom mode kicked in, and we got the steroid and we got the epinephrine, and it's really scary to watch your own kid go through that. And I can remember the ER attending and the residents, and everyone's like, just remember, put them in the freezer, like open the freezer and put their face in it, and it'll help that airway a little bit too. And it was winter time, and they were like, you can even take him outside. Like, I know it sounds crazy, but it's the one thing that definitely helps them relax a little bit. For my follow-up, I would do a pediatrician follow-up within 24 to 48 hours for reassessment, just to make sure that respiratory status is getting better and not worse, that hydration is getting a little bit better, maybe he's perking up with his appetite, and that the symptoms aren't progressing. You want to educate your patient for symptoms of croup. They do worsen at night. Like I said, when my child had it, I don't think I slept that night. I was up with him, just making sure that he was upright. He wasn't, rolling and, going flat or anything like that. I just wanted to make sure that he was able to breathe. That peak severity is typically on day 2 to 3 of the illness. And shockingly enough, that cough can actually last for a really long time. Even if the illness is gone, the cough lingers. So a barking cough can last for 3 to 7 days. Biggest thing is you want to tell your patients to return to the ER if any stridor at rest returns or worsens. There's an increased work of breathing, the use of accessory muscles, retractions, nasal flaring, or rapid breathing. These kids are, resilient and they can go through a lot. So if they are getting to that point, they're going to tire out quickly. So you want to make sure they get the help that they need. Cyanosis, drooling or unable to swallow, lethargic, decreased responsiveness, and then poor oral intake or signs of dehydration. Um, for community resources, you want to educate them about the pediatrician or go into the ER depending on how they're feeling with the symptoms that they're witnessing. The American Academy of Pediatrics, and there's the website there. You want to give them evidence-based guidance for CROUP, the CDC website, and then any information on viral respiratory illnesses. It's going to be going around, especially in the wintertime, and you just want to make sure that these parents and daycare places and everyone else knows, like, keep things clean, wash your hands, no kissing, nothing like that. You just want to make sure that you are doing whatever you can to try and stay healthy. And then providing reliable education sources improves parents' understanding and outcome. Education continued. I would also help with home management support. So you want to make sure that you have written discharge instructions as well as verbal. I can sit here and tell you to your face what to do, but when you get home after, being up all night or having a really long day in the emergency room, you're not going to remember what I said. So it's very important to have written discharge instructions that they can read when they are calm and relaxed and in the comfort of their own home. You want to give a symptom checklist for parents so they know what to look for, guidance on fever, hydration, and when to seek help. Access and safety considerations. I would just make sure that the family has reliable transportation. Like we said, we never know when this is going to go from 0 to 100 and they have to get to the nearest emergency room as quick as possible. So you want to make sure that they are able to do that. Access to emergency care and ability to obtain medications. In today's world, it's really scary seeing a lot of people's Medicaid and Medicare cut, and we just want to make sure that these families are able to get the access to medications that they need and their babies need. For daycare and school guidance, the child may return to school when the fever is resolved. I usually, tell people within, like, as long as they are like 24 hours free of Tylenol and they don't have a fever, absolutely you can send your child back to school. I keep mine home unless they are 24 hours free for sure. Their breathing has improved. They're looking back to their baseline. Education on infection spread prevention. So hand hygiene is going to be the biggest thing. Make sure you are washing your hands, keeping that child home and away from symptomatic people. I know not everyone agrees with that, and they might be upset with you, but it's the safety of you and your kids is the most important thing. And additional support, nurse advice lines. Some first-time moms, or it could be their 10th kid. It doesn't matter. You want to make sure that they know who they can call when they can call 24 hours, an hour. So you want to make sure they have those lines. Telehealth follow-up is an option if they don't want to bring their kids around some other sick kids. And then community health clinics. And these are my references that I used. I hope that you guys enjoyed my case study on CROUP. Thanks so much.